As part of World Mental Health Day 2022, the Meghalaya Health Minister James P.K. Sangma on October 10th announced the draft Meghalaya Mental Health and Social Care Policy, which will be made available through the website of the Health and Family Welfare Department and the National Health Mission Meghalaya. At the same time, Sangma also expressed his gratitude to everyone who had contributed towards the making of the draft Meghalaya mental health policy.
This policy has been in the making for quite some time. Um, this committee, which was formed to look into drafting this policy, was formed some time back under the chairmanship of our principal secretary, who was tasked to um, come up with the policy. And accordingly, there have been a number of meetings which have taken place uh, to, towards the drafting of this policy. Um, Another subcommittee was also formed to go into finer details of the policy, which was formed some time back. And this subcommittee was headed by Dr. Vandana Gopi Kumar, who also is one of the members of the National Mental Health Policy Drafting Committee, and also one of the members of the Tamil Nadu State Mental Health Policy. So she, along with other team members of the subcommittee, including Samvad, who have been instrumental in providing a lot of work in terms of adolescent and child mental health. We've been able to today, because of the work put in by the subcommittees and by the committee, come up with a mental health policy which is very, very holistic in nature. So this is the draft policy which is being made available on the website of the Meghalaya Health Department, and this will be made available for the next 15 days, seeking the views and comments of the public. I would like to take this opportunity to urge the people of our state to go through this draft policy and to give us their suggestions, their views, and their comments, uh, whether they are in agreement or whether they are in disagreement, whatever the case may be. We seek the views and comments of the public, because they are the biggest stakeholders in this whole exercise. And I hope that people will go through this draft mental and social care policy to come up with good suggestions, which we will be able to incorporate into our policy. Um, I would like to mention here that we are very grateful as a department uh, to the various people who have made immense contribution to this whole exercise. The whole process has been done in a record time, I must say, and which is indicative of the fact that the people who have worked on this policy have worked tirelessly night and day, and they have come up with this beautiful policy which is very, very holistic in nature, and which is why I would like to place on record my thanks to not just my officers, the principal secretary, our secretaries, MDNHM, our directors of our health services, our additional directors, the Meghalaya Institute of Mental Health and Neurosciences, um, and all the other participants who have contributed to the mental health policy, but also specifically to Dr. Vandana Gopi Kumar from the Banyan, and her other colleagues, Dr. Sanjeev Jain, Dr. Alok Sarin, Dr. Kishore Kumar, and all the members of Banyan, the members of Team Samvad, who have also been so helpful in helping us draft this policy, and the other members who have been part of this team, like from NIGRINS, from NIMHANS, that is the National Institute of Mental Health and Neurosciences, um, our policy research fellows from the PSAMA Fellowship for Legal and Policy Research, um, from seven hospitals of Shillong and Tura, from the Lancet Psychiatry Commission on the Psychosis from Cornell University, from the Schizophrenia Awareness Association, from the Tata Institute of Social Sciences from Mumbai, the LGB Regional Institute of Mental Health Tezpur, Assam, the NYU Silver School of Social Work, the um, then many others. I would not like to go into all the names, but we are very grateful to each and every one of them, and I'm extremely glad that we've been able to complete this exercise and have this in time to coincide with the World Mental Health Day today, so that we are being able to send this out.
While briefing media persons, Sangma said that the mental health policy has been formulated to also address the critical gaps that may exist amongst young people in order to identify early signs of unhealthy tendencies. He added that the mental health policy also seeks to address issues of each citizen of the state who need help as far as mental health care is concerned.
The mental health policy seeks to address those critical gaps that are there. Gaps wherein we understand that there have been many cases, very unfortunate, of students having committed suicide, which is so sad. That if they had been able to maybe had somebody to listen to them, a counselor who would be able to identify the signs of suicidal tendencies, then we would have been able to save those children, which is so unfortunate. And we understand the fact that in today's world, students, they live with a lot of stress in their lives. It's not just adults who are going through stress daily, but students undergo a lot of stress, and that's what this policy seeks to achieve. To look at how we can have that support system readily available for them, which will be made available, as we have mentioned. I mentioned just that how do we make sure look at the pathways to seeking healthcare. So it's not just for students, but for anybody and everybody who goes through stress and feels that they need to just reach out to somebody and to talk to somebody. So those are the things that we are seeking. So pathways are a very integral part of this mental health policy, and we hope that with this, things will smoothen out, and will get more streamlined. But having said that, a government policy is always a living document. It is not a perfect document on its own. Sorry. So it is a document which will continue to grow, to change, to adapt to circumstances, and this, I believe, is a start. And it was very important that Meghalaya took the initiative and took this start. And I feel that this is going to pave the way for much more better healthcare for people with mental health issues.